The National Drug Law Enforcement Agency says the fight to curb illicit drugs and substance abuse will not do much good if there are not enough rehabilitation centers to provide care for those fighting addiction. The chairman of the agency, General Mohamed Buba Marwa, made this known during the opening ceremony of a training for wives of the 36 state governors of Nigeria in Abuja. Marwa, who decried the shortage of rehabilitation centers across the country, says it negatively impacts on their duty of successfully rehabilitating addicts into the society.
We counseled and rehabilitated 10,904 drug users in 2023 in our counseling centers, which are located in 30 commands of the agency. In our advocacy drive, targeting governors and their spouses, religious leaders, traditional rulers, community members and social groups, amongst others, we have reached out to all 36 state governments concerning the establishment and strengthening of the State Drug Control Committees, SDCC, and the Local Government Drug Control Committees, LGDCCs. At the community level, we have also been advocating the inauguration of community war against drug abuse committees and WADA clubs in schools. I'm compelled to renew the call to governor spouses to please mobilize and engage stakeholders in your states to support prevention actions. Prevention remains our primary defense. In this vein, we must work tirelessly to educate our communities, particularly our youths, about the dangers of substance abuse and equip them with the skills and knowledge to make informed decisions. Your influence is needed to mainstream treatment for drug addiction in society. We cannot go far in our effort to curb illicit substances if we are not offering treatment for those already fighting the challenges of dependence on the substances. In this regard, I must bring to your attention the acute shortage of rehab centers in Nigeria. Some states do not have even one rehabilitation center. Please, Your Excellencies, we recommend a minimum of 3 rehab centers per state, 1 per senatorial district, and if possible, 1 of those 3 ought to be for women only. Issue of putting up structures to help drug addicts may not be on the top priority. Please make it so. Please make it so. Push for this to be uppermost amongst the top priority projects in the states.
As mothers, we understand the profound impact that drug abuse can have on our children's lives. Therefore, it is incumbent upon us to protect, nurture, and guide them towards a future free from the shackle of addiction.
The Nigeria Governor Spouses Forum included the eradication of drug abuse in our thematic areas of intervention to complement the efforts of government at the national and subnational level and the National Drug Law Enforcement Agency in ensuring that the menace of drug abuse is eradicated from our communities. The forum as a collective and in our respective states have held sensitization and awareness programs and extended our influence to cover empowering rehabilitated drug users as a way to prevent relapse while also deepening partnerships to promote this cause.
The first one is the issue of creating community-based drop-in centers. Now, in addition to the issue of treatment centers, and I will speak on that one as well, I think it is very important to bring the assistance and the services as close as possible as we can to the actual persons that need those services. So we need to move basically from a concept where we have treatment centers, maybe at state capital, maybe at senatorial district, to much closer move those services to the people actually affected by drug abuse. And that is not only those ones that are using drugs, but also their families and their friends. We are all still making reference to the 2018 data, which frankly speaking is actually 2016 data, because that was when it was collected. So you can start to understand of how outdated this evidence base starts to become.